Good evening, everybody. Dan Scott here. I'm answering Week 7's question from Mohammed Al-Mazraoui. And Mohammed this week brings up the question of American involvement in the securitization of infectious diseases in general, and HIV in particular. He's citing page 338, and he asked the question, do you think that the United States makes diseases like HIV/AIDS a serious consideration in terms of national security? Or because these diseases seem to be more prevalent in developing countries, do policymakers turn a blind eye to these potentially fatal diseases? I would say that there's no doubt that the U.S., like any other actor, is going to seek its own interests first. And if considering diseases like HIV and AIDS is a threat to the security of the state, then the state will take the appropriate action. And from a realist perspective, it's worth noting that HIV and AIDS are really unlike other infectious diseases that are more easily transmitted, that can more easily reach the status of security threat. And I say it for a few reasons. First off, the transmission of HIV/AIDS is difficult when compared to diseases such as influenza, Ebola, Marburg, and SARS, all of which were mentioned in the text. HIV/AIDS is transmitted through contact of bodily fluids, notably blood and semen, whereas Ebola, for instance, is transmitted through bodily fluids like sweat and urine, things that somebody who's treating a patient who has Ebola is going to come in contact with much more easily. SARS can be transmitted through a cough, so again, that makes it all that much easier to transmit it among other people. Because of these conditions, the threat of a flu outbreak is considerably higher than a mass outbreak of HIV among the general population. Somebody with AIDS walking through Times Square isn't going to infect 20, 30, 40 people at a time, whereas someone with like a swine flu or an avian flu very well could. Diseases like malaria, also prevalent in developing countries, and especially in the tropical regions. It poses very little concern to the American government because presently it really only affects Americans overseas, like missionaries in Africa and Southeast Asia, American business people doing business overseas and so forth. I think a notable concern, of course, is the Zika virus, which has been making headlines lately. It's an infectious disease that's transmitted through mosquito, much like malaria, but it's becoming a very real security threat in places in like Brazil and Central America, and it's making its way north. But to some degree, I think it's a mistake to assume that developing countries automatically have a higher contraction and death rate compared to that of richer, more developed countries. Obviously Africa is the big elephant in the room when it comes to statistics on HIV and AIDS and things like that. But for example, when you examine the percentages using relevant data with table 23.1 on page 336, you can compare a relatively poor developing country or region, Oceania being one. It's a developing region with a population of about 35.79, I believe, million, and it's experienced a 0.002 contraction rate and a mortality rate of 0.025. And you compare that with North America, who had an estimated GDP in 2009 of $20.3 trillion, and very, very wealthy region, who experienced a 0.032% contraction rate and a 0.017 mortality rate. So percentage-wise, when you consider the population size and the amount of people who had it, is really not all that dissimilar. Of course, every life matters, and so I don't like going with percentages too much, but I just think it's worth noting that it's not always the case of wealth being the difference maker. But to answer the question more directly, I would say the United States securitizes whatever it perceives to be a threat to its national security and its interests. So is HIV and AIDS serious? Of course. But so are other diseases that transmit more rapidly and with greater ease in a globalized society. Diseases by their very nature are going to ravage developing populations because of living conditions and the quality of their medical treatment. But I think it's also important to remember that we can't have this American Western mindset of we're automatically the best because we're rich. For example, I have a good friend who has been trying to become pregnant for some time, and has undergone fertility treatment in the United States and with no success whatsoever. Recently, she was living over in Myanmar and traveled to Bangkok, Thailand to receive treatment there. And according to she's pregnant now. Things are going great. According to her, the doctors were much more knowledgeable and much more affordable than in America. So it really depends, and I think perhaps it would be a benefit to consider the role of culture, tradition, regime, and so forth when dealing with the matter of health security in the developing world. So, Mohammed, I hope that answers your question. I really enjoyed this one, and I hope to see you all sometime soon in the future.